My name is Lana Vestarkis. I'm a consultant obstetric anaesthetist by trade. I've done an obstetric fellowship in the UK, and I have been an obstetric anaesthetist. Well, I've been an obstetric anaesthetist since I started my training in 2004 and completed it in 2014. So a number of years now. I think it's the interaction with our patients, obstetric patients. So you're supporting not just them, you're supporting their partner, and you're also looking after their baby in a certain type of way. What I enjoy about it is that every day is different, every patient's different. You have to have excellent clinical skills as well as communication skills. You've got to be able to impart a positive energy and empathy towards them. So obstetric anesthesia is offered to all anaesthetists as part of our training. So we all have or get a little bit of flavor of it when in our training. I was very, very lucky that my mentor and role model is an excellent obstetric anaesthetist, and she encouraged my passion for looking after obstetric patients. And really, for me, obstetric anesthesia's got all the bits and bobs that you want from anesthetics. It's got the clinical bits, so you get to do regional techniques. It's got the resuscitative bits that you need to have when things don't go quite to plan. You've got to be adaptable. You've got to move from an okay situation to, oh my gosh, things are not going quite right. I need to up my game here. You've got to be good at working in a pressured situation because sometimes baby needs to come out now, and you've got to make that happen. The college offer you modules in obstetrics, so you have you do a number of modules throughout your training. As you become more proficient, you're allowed to do more and more with more and more distant supervision. You can work in different obstetric units, so you can start off you might do it in a smaller unit, and then you can go to a big tertiary referral unit where they will teach you different skills. There are courses that are run by the college, such as the obstetric SIG. There are certainly events around the country, so you can go to all of these to improve your training. You can do an obstetric fellowship if you have a special interest, which is what I did, and I thoroughly enjoyed it. You can also go to international conferences such as SOAP and OAA, international conferences which are excellent. There are journals such as the International Journal of Obstetric Anesthesia, and obviously there's always medical Twitter to give you free education if you want it, because it's actually very good. You get interaction with experts, on Twitter, like Noala Lucas, for example, or Cynthia Wong. So some excellent people out there for you. Obviously, you've got to be clinically on the ball and have excellent procedural skills. You've got to have excellent resuscitative skills as well, and being able to work well under pressure are all qualities that you definitely need. But I think the biggest thing for me is being a great communicator and able to interact with different people, and basically you're communicating with obstetrics, you're communicating with obs med, pediatrics, ICU sometimes, interventional radiologists. So you've got lots of communication, and obviously the most important people are the patient and their support and their support team, because you need to look after them and their partner. So communications is a really big part of it, and you've got to be able to be really empathetic and help them. Day-to-day is doing things like epidurals on the labour ward, covering elective cesarean section lists, covering emergency cesarean section lists, And then on top of that, you have things like a MDT, multidisciplinary team meetings with obs med and obstetrics and the neonatologists to just be able to discuss high-risk patients. There are high-risk obstetric anesthetic clinics that we run here in school. And then there's things such as like debriefing sessions with patients, obstetric patients, when things have been quite traumatic for them and they want to talk about it, and you want to make sure that you can tell them, address any concerns that they have. So all these things are a part of being an obstetric anaesthetist. I think the main thing is that we as anaesthetists care. We want to make your experience as positive as possible. We want to make sure that this life-changing event for you remember in a nice way, because we want to be able to say that we've helped you. That's, I think, what most anaesthetists will tell you, most obstetric anaesthetists.